Top 20 Clinical Nurse Educator Interview Questions and Answers. Welcome to our channel. So before we get started, make sure to hit that like button, subscribe to our channel to join our family. Clinical nurse educators are devoted to teaching nurses who work in healthcare facilities in the skills and knowledge that are needed to give the best possible care to patients. These educators are respected nurses who have strong leadership and organizational skills. This profession is highly respected, and you can be a clinical nurse educator if you are interested. To join an organization as a clinical nurse educator, you will have to go through an interview that will include certain questions. Some of those questions are given below along with a sample answer including 2 tips to help you create your own answer. Number 1. Why are you interested in this role? Tip 1. The interviewer wants to know about your interest in being a clinical nurse educator. Tip 2. Mention a personal story in your answer. Sample answer: I am someone who loves the process of teaching and learning. I have always settled myself in any surrounding that involves delivering skills from one person to another. The clinical nurse educator's role serves nursing staff and patients. The flexible and stimulating work environment has made me more interested to enter this field of teaching and learning. Number 2. What are the roles of a clinical nurse educator? Tip 1. The interviewer wants to know about your understanding of this role. Tip 2. Mention the roles you have played in your previous position. Sample answer: the clinical nurse educator, also known as nursing professional development specialist, is responsible for providing various training and other developmental duties in a healthcare facility. Most of their work is focused on making sure that the nurses have the right training and skills to get better in their units. They are responsible for designing the curricula, teaching students, advising students, evaluating them, promoting discussions among students, and overseeing students' clinical practice. Number 3. What are the qualities that a clinical nurse educator should possess to be effective? Tip 1. The interviewer wants to know about the knowledge you have for this role. Tip 2. List the specific qualities that you possess. Sample answer: being in the role of a clinical nurse educator, one has to possess certain qualities that serve the organization best. One must be properly educated, have teaching skills, can work well alongside the rest of the staff, possess the skills and expertise, show understanding of assessment skills, have a love for nursing, and possess strong communication skills. Number 4. What major challenges did you face during your last role? How did you handle it? Tip 1. Talk about the challenges you have faced with complete honesty. Tip 2. Show that these challenges make you work better. Sample answer: as a clinical nurse educator, I experienced several moments that challenged my abilities. I had to be extra careful and cautious about many things during that phase. The significant pain challenges were the long working hours, workplace violence, personal health, and staff shortages. These challenges made me a highly skilled professional. I gained valuable experience and became a better clinical nurse educator. Number 5. Describe your daily routine as a clinical nurse educator. Tip 1. Talk about those days when you accomplished more than usual workload. Tip 2. Highlight the main elements of your daily routine. Sample answer: my daily routine in my previous role included primarily a teaching role. I had to cover the course content and syllabi using teaching strategies and evaluation methods. I also carried out meetings and participated in committee work. The scholarly activities included writing for publications and advanced teaching for special cases. Student advisement was also part of my responsibility. Number 6. Briefly describe your experience as a clinical nurse educator. Tip 1. Talk about what you learned by being a clinical nurse educator. Tip 2. The interviewer wants to know how you feel about this profession. Sample answer: I have been working as a clinical nurse educator for a long time. This was one of the most rewarding professions I have ever landed in. This field gives me a deserving amount of money and the moral satisfaction that I am doing something that benefits other people. Number 7. What strategies and mindset is required for this role? Explain with examples. Tip 1. Mention the strategies that you used to be better at your previous job. Tip 2. Highlight the things that the organization looks for in a new hire. Sample answer: being in this role, I have learned several important lessons, and one of them is developing strategies that will help my students learn better. A set of strategies and the mindset I have formulated for this reason are these: lecture high fidelity concept mapping, online course games, role-playing, jigsaw, classroom case study. These strategies have helped me deliver my lessons better, and I have become more efficient in managing the other tasks that are a part of each day. Number 8. What is the biggest challenge that you foresee in this job? Tip 1. The interviewer wants to know about previous challenges you have had. Tip 2. Talk about your challenges honestly and show that you are growing because of your challenges. Sample answer: I believe in being challenged enough to sharpen my skills. I love it when I am challenged by so many things that it allows me to use the best of my skills and prove my abilities. In this role as clinical nurse educator, I faced a few challenges, including the lack of opportunities to update knowledge and skills, CNEs not being ready for clinical teaching, and the lack of students' preparedness. These challenges indeed tested me, but I have advanced my skills to counter them in any surrounding. Number 9. How do you stay motivated at work? Tip 1. Discuss the things that help you stay motivated. Tip 2. Give details if it is related to an emotional bonding. Sample answer: many rewarding things in the clinical nurse educator profession can help you stay motivated. First, the idea of being able to serve either a human being or the whole of humanity by teaching him or her a lesson is what makes me feel over the moon. Apart from this, I use my desire to teach and coach to help keep me going strong on the workload days and during high-pressure times. Number 10. Describe a time you failed in this role and the lesson you learned. Tip 1. The interviewer wants to know how honest you are about your role. Tip 2. Highlight the things you think are good to mention. Sample answer: most people who fail will never recover from it. For me, failure is another chance to try again and do better. I worked in a situation where everything I learned was through hands-on experience. Once, while writing a paper, I was too confident and I lost track of the work I had done and lost the data. That's when I realized that technology is here to stay. That presentation was gone in vain, but I learned to keep extra copies of my data after that. Number 11. How would you handle someone who isn't performing well? Tip 1. The interviewer wants to find out what interpersonal skills you have. Tips 2. Think about a time you were in this situation and be honest about it. Sample answer: in this case, I would start spending more time with the student having trouble. I would try to find out the issues that have affected his or her education standard, going above and beyond to help that student. Number 12. Explain how you would make a patient care plan. Tip 1. Be concise, but show that you have interest in the task. Sample answer: one must be flexible, creative, and must not be shy about impressing with the right skills. The patient care plan is made with the latest clinical learning abilities and a creative approach. At this time, nurses face more challenges, and they need protection. I would like to know some more information about the patient care plan. Number 13. Why should we hire you as a clinical nurse educator? Tip 1. Mention the skills and abilities you can provide to the organization. Tip 2. Tell them why you are better than other candidates. Sample answer: to be a clinical nurse educator, one must understand the needs of nurses when it comes to skill sets and technical knowledge. I can serve my region by being more inclined towards my goals of teaching nurses. I would love to see my students being advanced in their careers in nursing. Number 14. Describe a time when you had the opportunity to help someone who needed you. Tip 1. Discuss a time when you wanted to help someone who needed it. Tip 2. Show how well you can judge the situation. Sample answer: I first evaluate the whole situation and consider the criteria I would use to make the decision. I am able to quickly assess the incoming situation and then commit to the best and most appropriate action. Number 15. Talk about a time when you initiated a new program for study. Tip 1. Show your ability to create and be innovative. Tip 2. Mention a time when you have done this in a previous role. Sample answer: during a new study program I started, I looked for candidates who showed a creative thinking ability. I then made sure to keep track of the candidates who were answering and contributing both positively and negatively so I could make improvements. Number 16. How would you get along with an ill student? Tip 1. Discuss how you would manage the student's progress. Tip 2. Tell how you might boost a student's confidence. Sample answer: being in this role of a clinical nurse educator, one has to be very cautious of differences. The nursing field includes all kinds of students and you have to work to show the students your interpersonal skills and authoritative ability to train and support each student. Number 17. Have you been in a situation where you were not able to train the nursing staff to use a new piece of equipment? Tip 1. Talk about your reactions in such a crisis. Tip 2. The interviewer wants to see how well you do at problem solving. Sample answer: a good candidate knows and identifies with their shortcomings. An educator shows a willingness to keep up with the current technologies and how to manage their operations. These technologies require certain attention towards them to run smoothly. When things go wrong, it is necessary to stay calm and try to solve the problem. Number 18. How would you handle a disruptive student in the class? Tip 1. Mention the skills needed for dealing with such students. Tip 2. The interviewer wants to see your authoritative skills. Sample answer. First, make sure that the person has their own confidence and presence in the class participation and that you acknowledge his or her natural abilities. He will be made to feel authoritative and assertive. I will also keep a note of the candidates who themselves are feeling unsure of the abilities they possess. Number 19. How would you deal with a doctor who is rude? Tip 1. Mention your skills and any previous examples of dealing with such people. Tip 2. The interviewer wants to test your problem-solving skills. Sample answer. First, I will bring the issue to my superiors. If the doctor is displeased with me for some reason, I will find out what it is so that I can take the right actions to rectify the situation. I would also ask the doctor if there is something in my performance or care of the patients that they felt needed discussion. Number 20. Are you a team player? Tip 1. The interviewer wants to know if you have the skills to work in a team environment. Tip 2. Show that you are a team player. Sample answer. Yes, I love working in teams. They help you grow, learn, inspire, and form a set of closely knit group of people to rely on. These were a few questions that you must prepare before going into an interview for a clinical nurse educator role. Let us know if you have any question and comment below. If you enjoy this video, please like the video and also subscribe to our channel. Thank you for watching.